I'm wearing frozen bananas. So, yeah. They're one of the Christine's birthday pouches. I like only wear holodeck because I like compared to other pouches, nothing else is as good. Oh, those were nice too. No. Okie dokie. A few things here. Head on over to Blackboard. So I was thinking about your exam and how much better people did on exam 2. I think partially because it was take home. And so I just decided I'm going to make exam 3 entirely take home. So it is already posted. You just download it. I meant to print out copies and bring them in. So I'll bring in like a limited number of printed out copies for people who want them. You don't have to write it in. You can but do it that way. So the exam was originally scheduled for Wednesday. So let's make it due Wednesday, which I think I said on here. Yep, I might have put the wrong date though. Yep, I did. Go me. I actually knew the date. So it's due by midnight a week from today. So you've got a full week to work on it. And then, yeah, you can either download it, type on it, re-upload it, or like I said, I'll bring in print copies if you don't want to print it out yourself. If you've got prints, you got pages and you wanted to print it out yourself and start it before then, feel free. You could also print it and scan it like y'all did last time. So whatever works best for you. But I just thought, do I really care if you have this stuff memorized? Like honestly, if you go on in your lives to be practicing people who do assessments, you will always have all the reference materials like keep showing you, right? So hopefully that takes some stress away from y'all, and hopefully, yeah.
That's the reason why I asked you, like therapy to be, I guess I'm trying to do that. That's the reason why I asked you, like, actually, would they be giving assessments? Would it obviously not have knowledge about assessment?
Good question. Yeah, so most therapists, I would say, end up only doing like an intake interview, basically. So like your first session would always be assessment, what's going on with that person, figure out a diagnosis, and then that helps you with your treatment planning. Depending on what type of practice you want to go into, you might end up, right, doing more assessment. So for example, and this is a little plug. If anyone is thinking doing therapy in the future, I'm teaching my clinical psych class next semester. And we go through all the different types of therapy. We go through how assessment's used. I bring in tons of guests. So I have like a working psychoanalyst. I have someone who like does assessments for a living. All come in or Zoom in. Last time we Zoomed them in, so maybe I'll do that this time. But yeah, so like for example, one of my colleagues who works at, like, she has a private practice, but it operates out of Chesapeake Bay Academy. Her practice is entirely assessments, because what she does is she does assessments for learning disabilities, essentially. Or if, let's say, you wanted to get into the legal system, right? You wanted to be the person who's like involved in not guilty by reason of insanity or custody cases. Your job is also going to be mostly assessment, because you're going to be the one helping to make those determinations, essentially. If you go more of like a hospital setting, it'll probably be more of a mix. So for example, while I was on my internship, I rotated through a whole bunch of different scenarios. And like when I was on the spinal cord injury unit, every person that they had under their care would have to come in once a year for an overall assessment, just like a checkup, basically. And psych would be part of that. So every person that came in would do like an hour interview and checkup with us. But there were also people who, in addition to their spinal cord injuries, had head injuries, and I would like do an RBAM for them, for example. When I was on the HIV clinic, we assessed depression, every single person. So the same thing for the MS clinic. But the MS clinic, we might also do some memory stuff. So I guess what I'm saying is it will always be a part of what you do. It's just based on your setting, it'll be more or less of a part. Or let's say you want to be a neuropsychologist. There's another example where like your whole job pretty much is going to be assessment, like figuring out those memory issues. So yeah, that's a really good question. I would say every single person who ends up being a counselor, a therapist, a social worker, got to know at least the basics of this. But then depending on the setting you end up working in, you might do more or less of it. Yeah, that's a really good question. Let me actually like do a full plug for my class for anyone who hasn't registered for classes or anyone who might want to change classes. Because I don't remember what time I scheduled it, so. Oops, no, not Blackboard, Web Advisor. That would be helpful. There we go. All right, so it is like 3:54, and it's going to be Tuesday, Thursday at 9 a.m., which is like a new time next semester. They bumped the 9:30 up to 9. And it'll be in the room right next door. So if anyone is, I mean, again, you don't have to take this class if you're thinking about being a therapist, but it certainly will help you conceptualize things. So if you're thinking at all, ooh, maybe that's something I want to do, I'd recommend this class. Just because we do like role plays and things like that. It's a nice follow-up to this class because you get more of that therapy experience. Yeah, there's my little plug, because right now it's under enrolled, which has literally never happened to me before. So tell your friends, take my class so that it makes and I can actually teach it. Any other questions about like the logistics of how assessments work into clinical practice? That's a really good question. Okay, well, cool. So today we're going to finish talking about our questionnaire-based ones. And then we'll start talking about projectives, which is why I wore my Rorschach dress today. So, yep, it's
like that, and I thought you were just like over.
it's a lucky Halloween, yeah. Yeah, it's like bats and wolves. At least that's what I see. What might this be? We'll talk about that in a couple minutes. All right, so we're almost through the MMPI. We were talking about the specific problem scales. And let me go ahead and just do this. I've discovered that's the best way to do it on the screen so y'all can actually see. So we were talking about some of the new scales like compulsivity. There are anxiety-related experiences, which are like panic and dread. It's actually most highly correlated with PTSD, not panic disorder, which is really interesting. But in PTSD, you experience a diffuse number of anxiety-related symptoms. Anger proneness, becoming easily angered or impatient with others. It's your affective experience of anger. And then behavior restricting fears are fears that get in the way of you doing things you want to do. So it's most related to a disorder called agoraphobia, which is basically like fear of crowded spaces, fear of being out in public, things along those lines. More specific problem scales, there's family problems. This used to be linked with the interpersonal scales, but they found that it's actually more related to those externalizing behaviors, the acting out, things along those lines, so they put it here. You do have to follow up with them because the MFPI questions are very generic. They're just like by family. And so you have to ask them, like, are you thinking of your family of origin? Are you thinking of like your spouse, right? Juvenile conduct problems. These are difficulties at school and home. It's like a history of juvenile misconduct. Substance abuse, current and past misuse. This is very face valid. So you do have to check your reliability scales or your validity scales, sorry, to make sure they're answering honestly. Impulsivity is another new one. So this is difficulty in reining in your impulses. And I thought that this one was really interesting, that they found that if you're high on both this one and the suicidality one, we like really need to think about whether we need to like inpatient hospitalize you, basically, to protect you. Because it means you might follow through with those suicidal ideations. Activation is being overstimulated, having racing thoughts, difficulty sleeping, euphoria. So this is like a manic episode type thing. Aggression is physical aggression and violent behavior as opposed to like the subjective experience of anger we just talked about. And then cynicism are non-self-referential beliefs that others are bad and not to be trusted. So low scores are people who are like gullible. And if you see that with high scores on the like somatic complaints, sort of physical problems, manifesting psychological issues, then you really start looking at things like conversion disorder, because we know that those people are often very suggestible. Interpersonal scales, self-importance, beliefs related to having special talents and abilities. So it taps into grandiosity, this is new, and narcissism. It's like a sense of superiority. It's not like, I'm proud of what I can do. It's like, I'm better than everyone around me. Yeah.
Would it be the delusional about being that?
Sometimes it could get to that level, but most of the times
They are that.
where narcissism, they just, not the level of delusion, they just believe that. And like, they might be slightly better, but it's like, it's just such a part of their identity, right? That's what makes it different. Like some of us might be like, yeah, I'm better at, my psych classes than other people, or I'm better on, the soccer field than other people. But that doesn't become our whole identity, right? Yeah, and the really interesting thing, I've only ever seen one person with narcissistic personality disorder, but from my experience with him, and then also from reading about it as I was preparing to work with him, a lot of times anxiety is the undercurrent of it. It's like you almost put on a front because you're anxious, you're not that good. Yeah, it's like a little bit like covering for poor self-esteem by like pretending you're better, or like trying to convince yourself you're better than other people. Yeah. Dominance is being domineering, being overbearing, believing they should all be in charge. Disaffiliativeness is just disliking being around people. They just don't have any interest in other people. And we talked through diagnoses. In a couple weeks, we'll talk about schizoid personality disorder, where it's like they just sort of like don't care about other people and this is that vibe. Social avoidance is just not enjoying social events. This tends to be related to people who are maybe more shy. It could also go to avoidant personality disorder. And then there's one that just measures shyness. And extremes on this could be social anxiety, or gets to the point where it just is like almost paralyzing or panic attack inducing. So these people would be interested in interacting socially, but like their anxiety keeps them from doing it, as opposed to these folks who like kind of don't care, if that makes sense. All right, and then the side 5, getting at personality traits. So aggressiveness, this is like goal-directed aggression. You engage in physical or verbal aggressive behavior to try to get a certain outcome. So these are people who like bully other people or bulldoze other people to like get ahead in life. So again, with the narcissistic people, but also people with antisocial personality disorder, psychopaths would score high on this. And then psychoticism is disconnection from reality. So this would be schizotypal and paranoid people. Disconstraint would be under controlled behavior. And so these are people who are impulsive, things along those lines. Negative emotionality, which is also sometimes called neuroticism, gets at that anxiety, insecurity, worry, fear. And then introversion and low positive emotionality, social disengagement, and hedonia is not wanting to engage in activities you typically enjoy, or just because like you don't have the energy, basically. So I've been mentioning them, so I always think I should throw up pictures of them. This is Jack Graham and Yogi Ventura, my 2 MMPI gurus that I learned from. Again, I didn't know what the MMPI was till I went to grad school, and now I like know a lot about it. But I was really grateful to both of them because they're very down to earth. Jack especially. I remember I had a client who was, gosh, she was probably the most complex client I ever saw. So she came in for bulimia. She had a very severe version of bulimia, binging and purging several times a day. She was also using cocaine. And I often use her as an example because she came in and said, like, okay, I quit cocaine cold turkey, but I can't stop the binging and purging. I was like, how powerful that cycle is for people with eating disorders. And so our intake had gone pretty well. And then she came in for her first session, and I was walking her through the like standard manualized, this works for pretty much everybody therapy for eating disorders. And she started screaming at me. She was like, monitor, you want me to monitor my food? Like, I'm just not feeling safe. And like to the point that after I got her calmed down and she left, like other therapists were like, like, because like we use noise canceling machines and whatnot, but like people could still hear her, right? And then like, you know, we had 2 more sessions, and then I saw Jack because then I got her MMPI info. And I explained to him, I was like, Jack, here's what happened with her. And he was like, I don't see any evidence of, you know, that coming out of any sort of personality disorder. He's like, that's really interesting. And so it was cool for him to admit that, like, even though she answered really honestly, the MMPI had sort of missed this desperation she had. Or like, I was thinking it was personality pathology, that she might have also had borderline personality disorder, for example. And just so helpful. And like, just to sit down with like the guy who literally wrote the book on how to interpret the MMPI version we were using at the time, the 2, and have him just be like, so like, yeah, it failed us in this particular situation, was so cool. So I'm very grateful to both of them. When I did my training for the 3, I did it with Yossi, and that was fantastic. It was just cool to hear him again. And he just explains things really clearly. She stopped coming. I think she wasn't ready for change. So one of the things I used to say to my clients is like, I can't want this more than you do. I stole that from Tim Gunn. And so like, you know, make it work. But she was one of those that just wasn't ready to change. Yeah, and that's sometimes heartbreaking because sometimes she was someone I really worried about. Right, like my first client ever just stopped coming after 5 sessions. And I'd like to think it's because I helped her, but you never know. And you literally never know. I actually tell you another story. So after I'd been working here a couple of years, out of the blue, I got an email from someone, and she said, I don't know if you remember me, but you saw me when you were in Georgia. I had postpartum depression, and you saved my life. This is a woman who had come for 2 sessions, and I just really thought I wasn't helpful to her at all. But I had helped her like kind of think about what was going on. I'd helped her connect with someone so she could get on antidepressants. And sometimes you don't know, like that little bit can make a huge difference in someone's life. So that was like very touching to me that like I got to find out how someone did, right? All right, so as with any of our things, there are cons. So some of this the MMPI-3 has solved. Right, there used to be these really high correlations among the clinical scales, and they figured out that was that demoralization of it. So they pulled that out, and they're cleaner now. And so there were like these factor analyses things that were most variants, and some of this went back into creating the 3 main overarching scales. And demographic characteristics can affect interpretation of older versions, although again, with the 2RF and the 3, they've tried to really clean that up. The psychometric properties of the MMPI and the MMPI-2 are comparable, and of the 2RF and the 3, which is nice. So again, we don't have to shuck all of our previous research, right? Construct validity studies are very supportive that it actually does relate to like how therapists diagnose people and how they rate their clients on certain things. So it's a pretty reliable source. And I mean, like this is definitely admissible in the court of law, for example. So it's something that is recognized as something reliable and valid. Very widespread use and acceptance, good psychometric properties. And then it really is the leading personality test. I would say the vast majority of people use this one. Okay, but there are other versions like the MMPI. And so I have a couple other examples. This is the PAI, the Personality Assessment Inventory. Very similar to the MMPI, but instead of just true, false, you've got 4 you can choose from. False, not at all true, slightly true, mainly true, or very true. I don't know, to me, I'm like, I don't really know what the difference between like mainly true and very true is, right? Like I could see some issues with interpretation, but it has pretty good psychometrics. So again, pretty sure, I think because things like this exist is why they made the 2RF and the 3 about the same length, right? Because that was the one drawback of the MMPI and the MMPI-2 was that it took a little longer. Similar in terms of having some validity scales, some clinical scales, treatment consideration, and interpersonal scales. This was developed using a method called the rational method, which is basically experts sit there and go, if I wanted to measure depression, what do I want to ask them, essentially? So the items seem to measure what the researcher wants to measure directly, obviously, and rationally. The test creators for the PAI said they developed it conceptually, but it was just the rational method. They had clinical judges rate how much they agreed the items measured what they were supposed to measure. So some sample items here. People are afraid of my temper. People once close to me have let me down. That's on like one of the negative relationships one. The person was aggression. I can talk my way up just about anything. That's egocentricity. Some other examples here. My mood can shift quite suddenly. Someone who might have bipolar disorder. I've tried just about every type of drug. Right? Looking at some substance use issues. I'm a natural leader, looking at some of the personality characteristics. And for this one, they can just circle on here. The questions are there, the answers are there, boom. The PAI is used extensively by the VA. It's actually programmed into their system, which is kind of cool. So there's like have a version the client can just take on a computer, and then it scores it and automatically populates it to their chart, which is cool. So I learned how to do the PAI while I was on my residency. The PAI does have one really unique thing as well, which I like, which is they have what they call the skyline. And so they have this for several different comparison samples. So you can choose like people who are seeking therapy in outpatient settings, people who are seeking inpatient therapy, things along those lines. And these represent the average scores for people in that population. So then you can see how is my particular person doing compared to that. This is an example of a not very exciting. Yeah, like this, it's not really spicy. I left it all. I mean, sometimes you get that and that's fine, right? And certainly not above the skyline. Right, another one comes out of Patel's theory about personality in general, but also assessment of it. So he developed the 16 PF based on words and statements describing personality. So it has 100, I have 185, this older version had 187 items. And there's 16, hence the 16 PF, primary personality scales. So some example items, when I find myself in a boring situation, I usually tune out and daydream about other things. I have decidedly fewer friends than most people. And these are all on like a 3-point Likert scale, where it's like yes, in between, or no, or some version of that. There are other items that are like, if a heated argument developed between other members of a taking part in a group discussion, I would, and then A, like to see a winner, B, in between, or C, wish that it would just be smoothed over. So some of them are like that. Yeah.
So like, is there, let's say if someone tried like, if someone was taking a test that they were trying to have specific answers in order to get a certain goal, right? Is there ways that
Yeah, definitely. So 16 PF, not as much, but the MMPI, the PAI, those validity scales will get at that. Yeah, because there have been times in the past when lawyers have like coached people. Here's how you answer these items to get this diagnosis, right? But like if that's kind of not matching up on anything else, then you can look at it. Yeah, actually, one of the cool studies the MMPI lab used to do at Kent State was like bring students in and tell them to like purposely try to take it like a depressed person or something like that. And they found that like they're pretty good at picking up on that. So yeah, it's really cool that we have those built in to try to check for that for sure. But not everything does. So like this definitely doesn't. There are 5 global personality scales as well, getting at the big 5 again. And I have, I think, a diagram of this as well. Yeah, so the way you map out the 16 scales is you put their scores here, and they're all double-sided, which I like. So like, for example, this one goes from reserved, detached, critical, aloof, stiff, all the way to outgoing, warm-hearted, easygoing, participating. And so you get that double-sided rather than just like the pathological side. This was developed by factor analysis, which is a statistical method for finding order amidst chaos. It finds groups of things, in this case, items on the test, that are alike statistically. So you would administer to it large numbers of participants and then see which items, and the term we use is hang together statistically. But basically which items the statistics tell you group together. So what we'll be doing on Friday is y'all will be doing some self-report inventories. These are much, much shorter, and these are probably the most commonly used personality clinical type assessments in research because they are shorter. They tend to focus on one specific area of functioning. These are what you all are creating for your questionnaires, for your group projects. Okay, so they can be like mood, they can be like basic behaviors like social skills ability, or they can be cognitive, like thoughts or assumptions you have about certain things. So here's some examples from the Beck Depression Inventory, which I believe I have copies of for you all to take on Friday. And so this is, for example, like the suicidal ideation item. And I kind of like how the Beck works because it, instead of being like strongly agree, it has like 4 different statements that get at different levels of symptoms. And people find this easier to relate to. Like, I don't have any thoughts of killing myself. I have thoughts, but I wouldn't carry them out. I would like to do it, or I would do it if I had the chance, right? And so I also like that the Beck includes symptoms that are not in like the diagnosis, but people with depression experience. So things like, is it interfering with work? Or is it interfering with your sex life? Things along those lines that matter to people, but might not be a diagnostic criteria for major depressive disorder. You can also do observation. So we might have people do self-monitoring, where we send them home of more and more. This is done on apps, where you would, like, as part of therapy or part of your research, have people like fill out stuff on an app every day. We can do naturalistic observation, where we watch kiddos, through something like this, watch them in their natural setting, things along those lines. Alrighty. So next, we are gonna dive into our projectives. And so projectives are what people think of when they think of tests, right? When they think of psychological assessments, people tend to think of these, because these are the fun ones. These are the ones that are easy to visualize. These are the ones you see in movies. Like there's a classic scene in a movie where like they're showing the guy the ink blots and they're like, what do you see? And he's like, oh, it's a little bunny, blah, 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 like while they're being watched by like, I forget if it was like the police officer, the detective or what. And then he leaves the room because the psychologist is like, you're interfering. And as soon as he leaves the room, they're like, okay, what do you see? And the guy says, and then like attacks the other guy. Right, so we think of these when we think of things like that. So the idea behind projective tests is that when asked to respond to or explain an ambiguous stimulus, individuals will project their own individual thoughts, needs, interpretations, experiences into their stories and explanations. So a paper by the psychologist Frank in 1939 called Projectives, X-rays of the Mind. And they became really popular during the 30s and 40s, 1930s and 1940s, because the mode of therapy that was in then, and really the only mode of therapy that existed at that point in time, was psychoanalysis. So if you're not familiar with psychoanalysis, it's based on the theories of Freud. He tried to explain a lot of things, but his ideas were all kind of tied to sex and like having an attraction for your opposite sex parents and things along those lines. And how you progress through stages as a child affected what happened to you later in life. But we know that people were doing these types of assessments before Freud and before these were developed in the 30s and 40s. So like Leonardo da Vinci would do something similar to evaluate his art students. And Shakespeare said, nothing is either good or bad, but thinking makes it so, right? That it might be our interpretation of something. So to do projectives and interpret them, you need a heck of a lot of training. So the one that I'm trained on is the Rorschach, actually, the ink blot one. And to learn to give it, we had 2.5 days where we just talked about the Rorschach nonstop. Something like the depression inventory that I'm going to have you all do on Friday, you'll figure it out in like 2 minutes, right? So it's very different in terms of how much you need to know in order to do it and interpret it. You have to be experienced, you have to, in order to both get the data and then to interpret it afterwards. Even then, interpretation is often unscientific and subject to differences among examiners. Now, that is not true for every version of every test. We'll kind of talk about those differences, but in general, projectives tend to have fairly subjective interpretation. So they should never be the basis for firm conclusions, although certainly they have been used that way in the past, and certainly there are still people who try to do so today. And they're best used as the basis for developing hypotheses, which are explored with other data, like an MMPI or other things that might be more specific. So since the mid-19th century, psychologists have noticed that individuals give personal and idiosyncratic meaning when asked to describe ink blot. So Binet of Stanford Binet, that we've talked about before, proposed the idea of assessing personality functioning with these ink blots. He didn't develop it though. The Swiss psychologist Hermann Rorschach did, which is why it's called the Rorschach, as a way of diagnosing psychological disorders, and it was first published in 1921. And this was actually developed from a parlor game, basically like what you would play at game night, called Blotto, where this is back when you use like fountain pens, and so you'd have ink wells, and so they would drip ink on a piece of paper, fold it in half, and open it, and then it would be like little kids staring at clouds, like what pictures do you see in it? And that was the basis for the Rorschach initially, which is sort of interesting and hilarious in its own way. It'd be like using Cards Against Humanity, right, as a personality assessment. We probably don't want to do that, right? So there are 10 ink blots. 5 are black and gray, 2 are black and gray and red, and 3 are multicolored pastel. And I'm going to show you the ink blots. And let me briefly show you why I don't have a problem with that. Like technically, ethically, I'm supposed to protect texts. And in fact, like I think Wesleyan paid $70 for this when I got here. So why on earth would I just show you everything? Well, you go to Wikipedia, they have all 10 blots. And I mean, just the fact that like they're printed on a dress iron, like these are the actual blots. They're not like semblances of them, right? Gives you an indication that people have basically taken these things as being in the public domain, when technically they shouldn't be. So this is a controversy. When this first happened, psychologists tried to fight against this, but it just like never got taken down. And like the really problematic piece of this is like, not only does it have the blots, but it also has like common responses and like interpretation comments. which makes it pretty easy to like fake your responses to this test, right? So that's problematic. But I have the actual blocks, so we'll look at those. But first I want to tell you how you actually get it. And now one thing I have to say is that there are different ways to give this. The system I am trained on for both interpretation and administration is called the Exner system, EXNER. And you administer it to the person individually. You wouldn't do this in like a group setting. And each card is shown to the person twice. So first you go through and give them all in order, and you say your free association or response phrase, which is just, what might this be? And then you're not supposed to say anything else. Just hand the card to the person. It's somewhat a reality testing test. So if you give this simple instruction and get any kind of like deviation, you know it isn't your instruction causing the person to act weird, right? So if they're just like, it's an ink blot, or they're like, oh, it's glowing, right? Like those are two extremes of like, it's not my instructions that solicited that, right? Then you hand the card to the patient. If they ask you questions about it, you can just say, it's up to you. If they only come up with one response to the card, you say, take your time and look some more. I'm sure you'll find something else. And the reason you do that is there are 10 cards, but you need at least 14 responses to score it. I don't know why they chose that way, they just did. Originally, you could stop someone after they did 5 responses for each card. Now you can score 51 responses total. So I've only given the Rorschach twice after I was trained in it, and no one had close to that. But I can imagine a very verbose person might, or quick thinking. If they give you fewer than 14 responses, you can go back through and say something like, well, now you know how to do this, but I didn't get enough to score your answers. In that case, you'd go through them 3 times. But generally, most people can see more than one thing per card, so it's not a big deal. So then after you go through this free association phase, then you go back through the cards and you say, help me see this as you see it. You hand them the card and say, where did you see this? You're trying to get which part of it were they using. You want to be really collaborative with them at this point in time. Again, you as the examiner should not lead them, whatever you wish. You have to record their responses as close to verbatim as you can as they go through. So this, like, yeah, your hand cramps up, you're writing really, really fast, right? And you try to also write down behavioral observations as possible. So like, if they take the card and they rotate it, you're supposed to indicate that. You use shorthand like IK, or if they say looks like, you would just write LL. You can use carrots to indicate if they're trimming it up, or left, right, upside down, things like that. And you write down everything they say, even if it's not specifically about the card. And it takes about 45 minutes to an hour and 15 minutes to administer. Actually, it can be shorter. I want to say my first one I ever gave took about a half hour, and we got enough to score. So yeah, you hold up the card. This is card 1, and you say, what might this be? And you hand it to them. So what do y'all think? What might this be? Eagle breath. That's cool. What else do people see? There's lots of awesome answers. The wolf, yeah.
2 birds, so it's not a-
2 birds, yeah.
I see 2 gargoyles.
Oh, gargoyles. Ooh, I like that. Some people say they see like 2 elephants, or in the middle, they'll see 2 people with like praise hands, kind of. Yeah, so lots and lots of options.
The middle could be like or something, and there's 2 people, and like, because
Ooh, I like that. All right, so here's an example of one of the red ones. And yes, red was chosen on purpose to try to like elicit thoughts of blood, perhaps, right? Yep, that's what I see when I look at this one too, right? But again, you'll get lots of different, some people will just look at the black and say it looks like it's bears playing patty cake or something. Oh yeah, I see that, elephant fear. Okay, here's another one. Yeah, I see that. Yeah. Some people say it looks like two people like playing drums or something like that. It looks like just like a little snapshot of in the middle of the bow tie.
Oh,
Oh,
outside of those fancy, like, 1800s, like, jackets that had.
ooh, I see that. I like that.
That's like two areas.
Like, ooh, I like that too. This next one gets at some of the Freudian stuff. So yeah, if you look at the top, that's on purpose. It's supposed to look like a penis. Like this part up here, if you're looking really closely, it looks like a penis. And there are some of these that particularly are supposed to look like a vulva as well, just to try to see if people will talk about the sexual stuff. Just kind of walk you all through the rest of them here. This one, the common response is a bat, maybe not surprisingly. Although a lot of people say they see a bat in part one too, which I don't necessarily see. This one, a lot of people say it's like a monster, Bigfoot, something like that. I remember when we were learning just like basics about this in Jeff Graham's class, one of my best friends was like, it looks like a carpet with, you know, like really fuzzy. He was like, ooh, you're doing texture, and that means something. She's like, what? You know, other ones that look like people. And then we get to my favorite are the color books. I think they're really fun. And then, yes, I have our favorite workshop blog, that's 10. I just love this one. Some people say these look like crabs, seahorses. Some people say they look like fireworks. So yeah. I have to say, again, I only ever gave 2 of these, but people respond really well to it. I think because again, people think like, ooh, this is what I'm supposed to be assessed with, right? So very cool to give for that reason. I really have a couple minutes left and we'll come back to this, but I just want to give you a basic indication of how you start to look at writing down how they respond to things. So let me get to the one we just looked at, number 10. So all the different parts are labeled, and you have to indicate which part they used in describing it. With each of those, they kind of give you a different indication of things. One thing that I don't think anyone did here, it's a little more rare to do, is you can also interpret the negative space. So sometimes you'll have people interpret the white as something, and that means something different. And then, so they have like common ones, or ones that use the whole, ones that use portions of it. And then each of these have little things next to them. O is ordinary, U is unusual. And there's just a little line that's sort of like in between. So we'll talk a lot more about that and interpretation on Friday. And like I said, then we'll also do some personality questionnaires as well. So I will see you all then. And again, exam, take home, it's all posted. And I will bring some paper copies if people want them on Friday. Exam is take home. It's already posted. The whole thing is take home, like last time. It is due a week from today at midnight, so you can turn it on Blackboard. You can bring a hard copy, but you don't have to. So I will bring hard copies if people want them to fill out, if they don't want to print them out themselves. And then, yeah, you can also just do it online and upload it like y'all did last time if you want. So, or you can print it out yourself if you want to start it before Friday. That's fine too. I'm just trying to save people prints.